It's 8 in the morning at a community health clinic in Hialeah. The waiting room is standing room only. A woman in her 60s steps up to the counter, hands you a paper, and says something quickly in Spanish. You catch maybe half of it. You nod, she smiles and nods back, and you both move on. Inside that brief, polite exchange is a silent, critical failure. You assume she completely understood your discharge instructions. She assumes you grasped exactly where her pain is located. Neither assumption is correct. This exact scenario plays out dozens of times a week across Miami-Dade County, a sprawling region where roughly 70% of residents speak Spanish at home. This recurring breakdown stems from a structural gap in how we learn language. Classroom Spanish rarely prepares a physician for the specific linguistic demands of the clinic floor. Most generic Spanish courses and translation apps teach conversational basics. But medical Spanish operates on a highly precise register that those tools completely ignore. When you lack the exact clinical vocabulary to ask about pain onset or severity, you collect incomplete diagnostic data. If a patient misunderstands their discharge instructions, they might take the wrong dose, stop an antibiotic too early, or miss a crucial follow-up. To treat people safely and effectively, you have to move beyond textbook vocabulary and learn the hyperlocal, everyday street language your patients actually speak. The friction usually starts right at the intake. You can ask standard textbook questions to gather a medical history, but patients will inevitably respond using their own regional dialect. This map shows the disconnect. On the left, the textbook word for squeezing chest pain, opresivo. On the right, what you hear in Miami, aprieta. As it expands, the pattern repeats. Locals substitute clinical names for everyday terms, complaining about la presión or their azúcar. People in pain rarely speak in formal medical codes. You have to adapt to their register to build an accurate medical history. Moving into the physical examination brings up a new risk: linguistic false friends. These are words that sound perfectly normal, but mean something completely different in regional dialects, instantly derailing your clinical context. For example, if you are treating a Cuban patient who says they are consticleo, they are telling you they have a stuffy nose, not that they are dealing with constipation. This dictionary definition card illustrates the ultimate false friend. A doctor wanting to give a patient a shot might translate that literally to disparo, but disparo actually means gunshot. The word you need for a medical syringe is inyección. In a clinical setting, saying gunshot instead of injection is an embarrassing error that can terrify an anxious patient, bringing the examination to a halt. Once you have the vocabulary, delivering a diagnosis requires a subtle shift toward cultural tone. Specifically, how you use pronouns dictates whether a patient actually trusts you. Generic Spanish classes teach the formal usted alongside the informal tú, often framing the formal version as something reserved for strict professional distance. In Miami's Cuban and Colombian communities, using usted is strictly required as an expression of warmth, closeness, and deep respect, even among family members. Nailing that cultural tone is a necessary clinical skill. You need that mutual respect to ensure the patient complies with their treatment plan once they leave your office. Effective clinical Spanish is about functional accuracy. The priority is ensuring medical information moves precisely in both directions, regardless of poetic fluency. By locking down this focused layer of clinical vocabulary, you can safely navigate 80% of your daily encounters without needing to call in a complex translation service. Bridging the gap between generic textbook learning and real-world application is exactly why we partnered with StreetTongue. Their Mexico City module provides the conversational roots that shape the distinct dialects found throughout Miami's neighborhoods. Whether working in a clinic, ordering at a cafe, or navigating the street, download StreetTongue to prepare for the conversations that actually matter. Speaking of local dialects, we want to hear from you. What is a specific slang word or professional term in your city that outsiders always get completely wrong? Let us know in the comments below.